Namaskar. Myself, Dr. Shambho Shamrat Shamastar. I am a clinical pharmacologist and consultant at Diabetes and Allergy Asthma Therapeutic Specialty Clinic. I am also consulting at Allergy Asthma Treatment Center, Moulali. So when we are getting patient at Allergy Asthma Treatment Center, Moulali, we are getting lot of childhood obesity. So today's discussion is for the children, for the students, how to take back the remote control. Let's talk about childhood obesity, how we can prevent it, how we can tackle the adolescent obesity. Because when we talk about allergy management, be it allergic rhinitis, be it asthma, obesity is a major contributing factor. So, Namaskar. Today, let us begin not with a medical definition, but with a picture. Imagine your body is a school bus. The engine is your muscles. The fuel is your food. The driver is your brain. And the battery is your sleep. And the passengers, your emotion, friends, family, dreams, studies, different habits. Now, think carefully. What happens if bus gets too much fuel but never moves? The fuel become burden. And what happens if the bus keeps running but never gets good fuel? The engine become weak. And what happens if the driver is distracted by a mobile phone? The bus may go in the wrong direction, or you will have one accident. This is exactly what is happening to many children and teenagers today. Obesity is not simply about body weight. It is a signal that the balance between food, movement, sleep, emotion, screen time, and self control has been disturbed. The goal is not to become thin, the goal is to become strong, active, confident, happy, and disciplined. Let me take you to your school lunch break. Just imagine two friends open their tiffin boxes. One has roti, vegetables, egg, fruit, and water. The other has chips, cold drink, cake, and fried snacks. The second student laughs and says, "My tiffin is more exciting." The first student smiles and replies, "Your tiffin may excite your tongue, but mine supports my brain, my muscles, and most importantly, my future." That is the first lesson. So, food should not only taste good, food should do good. Eat less, but eat good. That does not mean starvation. It means wisdom. Eat slowly, eat home food, avoid frequent packaged snacks and sugary drinks. Do not eat just because you were bored. And please do not eat while endlessly scrolling on phone. That is a very important issue. আমরা মোবাইল দেখছি আর এদিকে খাচ্ছি, কি খাচ্ছি আমরা জানি না। Because when the screen is on, the mind is distracted. and the hand keeps moving from packet to mouth without permission from the brain. Now let us enter a jungle. Imagine that a tiger eats and sleeps all day, but never runs, never jumps, never hunts. Will it remain powerful? No, it will become weak. Our bodies were designed on only for chairs. You were sitting on chair and watching me. When you were in school, sitting on the chair. When you were at home, sitting on your bed and scrolling the mobile. So we are not designed only for chairs, coaching classes, and screens. Our bodies were designed to move. So exercise is not punishment for eating. It is not a punishment for your eating. Exercise is a celebration of being alive. You do not need an expensive gym. Just walk, run, skip, play football, play cricket or badminton, kho-kho, kabaddi, have some dance, cycle, take stairs, and if possible, a very good yoga we must appreciate. Do Surya Namaskar. 10 minutes every day is better than 2 hours once in a month. Please remember. Small daily movement become a lifelong prevention policy. It will provide a big lifelong protection. Now, let me tell you another story. One day, my brother showed me a viral Instagram video. A man was dancing on the roof of a bus stop. People were recording him, laughing, forwarding the video, and saying he has become famous. I looked at the video and became silent. I told my brother, "This is sad." He asked, "Why sad?" "He is dancing." I said, "Maybe his mental health is not okay. Maybe he is suffering. Maybe people are enjoying someone's pain without understanding it." Then I said something more important. Look at his balance, muscle strength. Really, he has better biceps than me, and body control. Physically, he may be stronger than many of us, but physical health alone is not complete health. Mental health may be compromised. So that story teaches a very important lesson. Health is not only weight, health is not only muscles, not only six pack, not only looking good in photos. Health means physical, mental, and social well being. We are now adding another well being here, that is spiritual well being. So, never body shame anyone, never call anyone fat, never laugh at someone's body, never make memes about someone's weight. A healthy student is not the thinnest student. A healthy student is one who can play, who can focus, sleep well, eat wisely, love kindly, and respect others. Many students eat not because they are hungry, but because they are stressed, lonely, bored, or sad. This is emotional eating. Before eating, ask yourself, just remember this. Before anything you eat, just you ask yourself, am I hungry? Or am I bored? Am I thirsty? Or am I stressed? Am I eating because my body needs food or because the packet is in front of me? Food is fuel. It is not a permanent bandage for every emotion. Now comes sleep, the silent medicine. If you charge your mobile only 30%, use it all day, what happens? Battery low. The same thing happens to your brain when you sleep late. During sleep, your brain stores memory, your body with different type of hormones repairs itself. Also, that hormonal balance will be prevailed. Your mood improves, your hunger signals controlled. Sleep well to study well. Sleep well to grow well. Sleep well to control weight well. And screen time? Screen time is like an invisible snack. It eats your time, posture, sleep, attention, and sometimes your peace. Have you ever opened the phone for 5 minutes and suddenly 45 minutes disappeared? Is it there? This is not magic. That is design. So control the screen time. Control the screen before the screen controls you. No screen while eating. No screen before sleep. After screen time, stand up, move. Now, let us go a little deeper. When you see pizza, smell biryani, hear the sound of a chips packet, or remember chocolate, your senses become active. The eyes say eat, the nose say eat, memory says last time it tasted so good. The tongue says just one more. In our wisdom, our ancestors, we may say the indriyas, the senses, try to overpower mana, chitta, viveka. In neuroscience, we say the reward system of the brain can overpower self control. That is why obesity is not just a lack of willpower, it is biology, psychology, environment, and habit acting together. There are modern therapies like GLP-1 based medicines, semaglutide, or GLP-1 GIP drugs, tirzepatide, used only under medical supervision. Please remember this. This is a serious matter. If one doctor prescribing you, you can take as per doctor's recommendation. It can help some patients by reducing the hunger, craving, food cue. That food cue reactivity is very important. It can be also reduced. But my dear student, my dear fellow brothers, the main medicine is still lifestyle. Good food, good quality food, daily movement, sleep, emotional balance, and self discipline. Finally, let us talk about spiritual health. Spiritual health does not mean only certain rituals. It means inner balance. It means asking, who is controlling my life? Who is controlling your life? Your tongue or your wisdom? Your mobile or your mind? Your craving or your character? Spiritual health strengthens vivek, the power to pause, think, choose. When junk food calls every day, viveka says, not today. When mobile calls at midnight, vivek says, sleep now. When someone is body shamed, vivek says, protect them. When your body wants movement, vivek says, get up. So from today, take back the remote control. Eat less, eat good, move every day, sleep well, be happy, reduce screen time, respect others, strengthen your viveka, because the aim is not only to reduce obesity, the aim is to build a generation that is physically strong, mentally peaceful, socially kind, and spiritually awake. We need to remember students' health is the nation's health. Thank you very much. Pranam. Jai Hind.